Good morning, everybody. Thank you so much for having me.
Hey, well, Russell, I'd like to start by saying that I think the presence of this hospital so close by was a factor when many of us made our buying decisions here on Dataw. So can you tell us what's going on with the hospital and tell us why this is no ordinary small town hospital?
Well, I mean, there's lots going on with the hospital. Obviously, there's both, as everyone's probably wants to hear about, a lot of COVID-19 that's been happening at the hospital the last 6 months. And I think I have a presentation that will, I think, hopefully give a comprehensive overview of how the hospital is doing, both as it relates to volumes today and over the course of the pandemic. But then, outside of what has been going on with COVID-19, we have a lot that's been going on behind the scenes in terms of how we're going on services, how we're recruiting new providers to the community, and really how we're going from a standalone community hospital to what we really like to believe we want to become, which is a community health system serving all of Beaufort County and moving into Jasper and Hampton counties as well. So lots to talk about today, a lot of exciting things going on, and hopefully I am here to answer a lot of your questions with the presentation, but after the presentation, hopefully there'll be a lot of other questions that I can answer as well if I didn't get to them in the slide deck.
Great. So did you want to start with your presentation?
Yes, absolutely. And we're going to try and share the screen and
Excellent. There you go.
all right, let me see if I can navigate this. So just because I wasn't sure who my audience was, I'm going to give a brief history of the hospital, some information around volumes, quality award designations, services we provide. I'm going to go into a little of a COVID-19 update, then I'm going to talk a lot about growth and strategy and just how we're working to serve the community. So as you can see, Beaufort Memorial Hospital was established in 1944. It was written into legislation as a county hospital. Our name is actually Beaufort County Memorial Hospital. And we were 25 beds at the time. Only had 4 doctors on medical staff, and the property was donated by Kate Gleason. We have Kate Gleason Park that sits right next door to the hospital. And our first baby was born on May 4th, 1944. And that is actually a picture of the baby that was born here on May 4th, 1944. Today, we've grown from 25 beds to 197 beds. We're not-for-profit, the largest one between Savannah and Charleston. So we serve a lot of people in those 3 counties. We have well over 1,600 employees. Within that 197 beds, we have 14 inpatient rehab beds, 14 adult mental health beds, and that actually will be growing to 18 beds this year. 7 operating rooms. We have a state-of-the-art Kaiserland Cancer Center here that sits on campus. Just a few blocks down from the hospital, we have an ambulatory surgery center, which has 3 ORs and 2 procedure rooms, in addition to those 7 operating rooms. And then you can see some of the services we offer, such as interventional cardiology with emergent PCI and cath lab, labor and delivery unit that was recently renovated. We have a robotics program to include minimally invasive GYN surgery, general surgery, as well as orthopedic surgery, breast health center, 3 outpatient imaging centers, and a network of occupational health centers and express cares across the county. I didn't mention that we were a nonprofit hospital, so there are for-profit and not-for-profit hospitals, and there are some differences between the two. And I've spent time at both for-profit hospitals and nonprofit hospitals. With really before hitting Beaufort Memorial, the majority of my career has been spent at for-profit hospitals. But the major difference between for-profit and nonprofit hospitals is all of our revenues after expenses are kept here in the community. Now, whether that is kept here in services to the community, such as mental health, shipmobile, sickle cell anemia clinics, renovations into the hospital, or given back to our employees in the forms of raises, market adjustments, gain sharing opportunities. Nothing that we keep, nothing that we make after expenses goes to what I would call a home office. If you work for a for-profit hospital, typically what happens is all revenues after expenses go up to a home office or a corporate office, and then some of those come back to the hospital in terms of capital improvements and opportunities for raises. But a lot of that goes to the shareholders and the investors. We provide care for all patients regardless of the ability to pay, and as a charitable organization, we can accept gifts from the community to make improvements and to offer new services. And that is a big part of what we do. We couldn't do all the services that we provide to the community without the foundation and the many generous donors and benefactors that contribute to the foundation. At a glance, so some of our volumes, we do almost 9,000 admissions a year, almost 190,000 outpatient registrations a year. So that's CTs, MRIs, physical therapy visits, chemo infusion visits, 53,000 emergency department visits. For comparison purposes, there are 2 other emergency rooms in Beaufort County, and they do about 44,000 visits combined. So we do about 6,000 to 7,000 more visits than 2 departments combined. So we are a high volume ER. We do almost 10,000 surgeries and just under 1,000 deliveries. So we are a busy hospital. We stay pretty full. Our ER sees, like I said, about 130 to 140 today. So if you compare that to even some, downtown metropolitan hospitals, our ER volumes are right up there with the Tridents of the world, et cetera. Labor cost, in terms of what does it cost to run the hospital, you can see how much we pay our employees in benefits, in salaries and wages, our supplies, insurance, and utilities. So total cost for caring for our patients is about $230 million a year. Of that 230, almost 50 million is charity care and bad debt. So that is free care we provide to the community, whether it's in our ER, whether it's in our sickle cell clinic, or through our Access Health program, we provide free specialty care. We provide about $50 million in free care back to Beaufort County every year. You can see our total operating revenue and then our total revenue. So we're about a $13 to $15 million total EBITDA hospital, or at the end of the day, about a $5 to $6 million total operating revenue hospital. So we are one of the few fortunate standalone hospitals that have a healthy bottom line. We continue to do so even in the COVID-19 world, and we're very proud of that because it allows us to continue to invest back into the hospital and back into the community. One of the things we're also very proud of is a lot of the awards that we've received in the last year or two through either the Joint Commission, the American Heart Association, or the South Carolina Hospital Association through our Zero Harm Awards. But you can see we're an Advanced Hip and Knee Replacement Center of Excellence. We were one of only 3 of those in the entire state. The other ones are MUSC and Prisma Health up in Greenville. We're also only 3 hospitals in the state have achieved Advanced Hip and Knee certification through the Joint Commission. We're a primary stroke center of excellence and a chest pain center of excellence with PCI intervention through the Joint Commission. And then you can see our American Heart Association for stroke and chest pain, as well as Zero Harm Awards, meaning that we've had 0 harm, 0 surgical site infections, central line associated bloodstream infections, et cetera, for anywhere between 36 and 72 months. And a lot of those are surgical related. So one of the things that tells you as a hospital and services consumer is that if you have a surgery done at Beaufort Memorial, you have a very low risk of contracting a surgical site infection, right? And so that's one thing that we're very proud of. We have a very sterile environment, very clean environment. We make sure we protect our patients from any harm. This is our mission, vision, and values. So our mission is to enhance quality of life in the Low Country through improved health, innovative partnerships, and outcomes. Our vision and our core values: safety, innovation, and compassion. We hold those tried and true, and those are printed just about everywhere in the hospital. So if you're walking around, you see safety, innovation, and compassion. Those are what we believe are our core values in the hospital. So before I get into a lot of the strategic planning, I'm going to talk about COVID-19 because that is what everyone wants to hear about these days. I've been getting a lot of requests to do a lot of speaking engagements specifically about COVID-19, whether that's about what's going on in the hospital, how many patients do we have, how many we've seen in our ER, what is the state seeing, or what do you think is going to happen over the next 6 to 12 months. I'm going to try and pull out my crystal ball and tell you guys. So here's kind of the current state of Beaufort Memorial, or South Carolina. So this was actually as of 8/28. I missed that on one of my slides. But this is just the state of South Carolina. So we've seen 113,000 positive cases, almost 2,500 deaths. You see how many negative tests have been done in the state of South Carolina, almost 770,000. You see the percent positive continues to decline. Can you minimize that for me a little bit, Leah, just so I can see all of my notes, please? Just I'm having trouble. Thank you. There we go. That's much better. So the percent was 8.1%, down from 20.4% the day before. And you can see from a teletracking standpoint, so DHEC is looking at hospital inpatient capacity, and the hospital statewide utilization rate is about 82%. Now that's not COVID-19 patients, as you can see. Only about 12% of the beds in the state currently are occupied by COVID-19 patients. And we have seen that decline. So I think a positive sign around COVID-19 in the state of South Carolina is we continue to see our bed utilization rates due to specifically COVID-19 patients going down across the state. It's kind of a graphical trend. And so what you can see is new COVID deaths, new positive percentage rates among individuals tested, and acute care percentage patients that are hospitalized with COVID-19. You can see overall trend lines look pretty positive. Over the last couple of days, you have seen the percentage positive cases amongst individuals tested in the state of South Carolina go up a little bit. A little concerning, but as all things go, you would still see a trend line going down. So I think something to watch as from a state perspective, maybe to be expected as schools start to open up and have opened up, as we would expect. You will see from the notes, pediatric patients are not immune from contracting COVID-19. So I think it's something to watch and be very aware of, but right now we're still seeing, I think, positive trends. Another way to look at it, again, the new positive cases and infections confirmed. So you see that blue trend line on the graph, and you can see the trend line is going down. And albeit the last few days have not been so good for us as a state, you still see that blue trend line going down, and we'll continue to watch that. And you see the gray line, which is the COVID inpatients, and again, a nice trend line down over the last month or so. So, all positive signs that we're getting this pandemic under control in the state. Not to say that it's going away, because it will not go away until there's a vaccine, obviously, and that we are still a ways away from that, having a vaccine that is on the market and then widely distributed. But, so long as we continue to keep the curve low and the positive percent down, I think that it's a manageable type opportunity for us as hospitals and healthcare systems. This is BMH specifically. So through the course of this pandemic, we've done almost 7,000 tests at our multiple locations, not including all of our pre-surgical OR testing. So these are people who have showed up to the ER, the express cares, our physician clinics, and needed a test because they felt like they were symptomatic and had COVID-19, or had come into close contact with somebody who had COVID-19. Total positive results is 1,366, total negative 5,200, or almost 5,300. And our percent positive rate across the entire pandemic is now 20%. A couple of weeks ago, it was at 25%. Before that, it was a little bit higher. So you're seeing that our percent positive is coming down overall, which is a good sign for us here locally. Currently in the hospital, we have 19 patients admitted. In July, we had close to 40 to 50 patients admitted. So, we were feeling the stress of COVID-19 in the July months. I think about especially middle to late July, which makes sense if, masking mandates weren't passed until July 4th and around that time. The disease takes anywhere between 7 to 14 days to convert. So, if you came into contact with someone with COVID-19 and you contracted it with that person, you typically wouldn't see that really feel the symptoms or effects of that for at least 7 days, sometimes up to 10 to 14 days. And then lagging indicator is admissions. So once you feel the symptoms, if you're going to be admitted, rarely are you admitted once you start feeling the symptoms initially. It takes another 7 days or so for those symptoms to really set in, make you feel worse. You come back to the ER typically, and then you're admitted. So you can see that while July was when the masking mandates were passed, really everything is a lagging indicator by 14 to 21 days. And so if you take that 14 to 21 days and fast forward to August, through all the mask mandates, you can see now that August feels a lot better to the hospital and healthcare systems as our percent positives going down, our admissions are going down. We are in a much better place. Of the 19 admitted to BMH, 8 of those are in the ICU, with 7 of those admitted. So what we do have in the hospital right now, those that are in the ICU are very sick. It is a devastating disease if you're in the ICU. And I was just talking to one of our critical care providers about this late last night. And, the devastating thing about this disease is not only are you on the vent for a long time, but the clotting factor that this thing causes causes a lot of cardiovascular issues down the road, but also causes issues around clots, throwing clots, PEs, etc. And the blood becomes almost congealed, real sticky almost. And that is what causes a lot of the complications with COVID-19. It's not just a lung issue, but it's a blood clotting issue as well. This is our BMH cases seen last week by location. So you can see that our 2 express cares in Beaufort and Bluffton are hovering right about 150 cases. And for the most part, that is down, which is a positive sign. Those are not positive tests. Those are just people came in, they had the signs and symptoms of COVID-19, so we ran a test because of that. And then you see our ER, we saw about 108 possible cases last week, which was down from 177 the week before. So positive sign. 36 of those patients were admitted. Total tests run through all BMH non-surgical related, because we do test all of our surgical patients 2 to 3 days prior to surgery to make sure that they are COVID-19 free before we move forward with an elective surgery. So we don't include those in this percent positive rate, but these are those that we're seeing across the hospital that are coming in because of this. 41 positive tests, so percent positive last week about 15%, and that number continues to trend down as well. If you included all of our surgical testing, that number would be much lower at 7-8% and or sometimes even around 2 or 3%, because we're probably running about 30 tests a day for our surgical patients. So this is how many we tested by that have been positive at Beaufort Memorial by age, by month. And so you can see the different age categories, 0 to 9, 10 to 19, 40 to 49, 50 to 59, etc. And you can see the 2 categories across the course of this pandemic that have really been leading the way are actually the 20 to 29 and the 30 to 39 age group. Those are the most positives we've seen at Beaufort Memorial. And you can see July was a really bad month for us, with August really coming back down. So June, you really started to see that number spike. July was the worst of it in terms of positive, and now we start seeing things start coming down in August, which is a good sign for us as a hospital and as a community. This is a graphical representation, again, by age group, by month. And so you can see that July, the 20 to 29, right there, that they spiked right there, and you can see the other age groups, and you see August coming down. So you can just kind of see the evolution of this pandemic and hopefully the de-escalation in the August and September months. This is by zip code. So a lot of times I do talk with a lot of the community leaders, mayors, county administrator, county councilmen, the sheriff's department, and we go over this by zip code. And this is, again, Beaufort Memorial related. And so you can see by zip code kind of how we're tracking at the Beaufort Memorial sites, with the Bluffton zip code really kind of leading the way, but some of the Beaufort zip codes not far behind. And this is just a graphical representation as well by zip code. This is admitted by age. So one of the things that people like to say is that if you're young and healthy, you don't get admitted to the hospital. Well, I will tell you that if you look at that 20 to 39 age group, they've been admitted to the hospital, and some of them have been very, very sick and on the vent. We've admitted almost 30 people in the 20 to 29 age group, 33 from 30 to 39, and 36 to 40 to 49. Obviously, we're admitting, those in the age groups of 50 to 90. But again, I think a misconception is if you're young and otherwise healthy, you don't really experience the worst of the symptoms of COVID-19, and that's just untrue. You can see the positive test admitted by age group by month, and again, you can see in July, you can see that's when we admitted the most of our 20 to 29 and our 30 to 39 age group, and obviously the age groups on down, the 60 to 69s, admitted a good bit of those in July, as well as the 70 to 79s. And this is like to stay. So this is the other thing we go over, but what I can tell you is we're still trying to understand this disease. There's still a lot of unknowns with this. And one of the things that in the March, April timeframe, you probably noticed that we didn't admit as many people. The difference was, however, we didn't know how to get these people out of the ICU. We didn't know how to discharge these people. We didn't know how to treat this disease. We didn't know about convalescent plasma and remdesivir and high flow oxygen and how to ventilate in a prone position versus the normal, et cetera. And so we were seeing our patients stay almost 15 to 20 days on average with COVID-19. So while we didn't admit as many people, we couldn't get them out of the hospital. because they were that sick. We weren't sure how to really treat this disease. Now, as we've learned in 6 months, these people are staying a lot less days. They have a shorter length of stay. In the ICU, instead of staying 30 or 45 days in the ICU, they're staying 10 or 15 days in the ICU or less, right? We're getting them weaned off of the ventilator and into a rehab program. We're really kind of figuring out how to treat this disease, and we're not perfect at it, but it's a testament to the medical staff about learning, going out and getting them remdesivir, the convalescent plasma, and really using that effectively to treat these patients. So we've seen our length of stay when this thing first started on average 15 to 16 days. Now we're about a 7-day length of stay on average. And you can see the older you are, more likely you're going to stay longer. But in the beginning, when we admitted some of those 30 to 39-year-olds, they too were staying 15 to 20 days. So, again, we're learning how to treat this disease, which is a very good thing for us. And probably why you're seeing that death rate go down a little bit, because we're getting better at treating. The death rate is not zero, but it is coming down because all the advancements we've made in the fight against COVID-19. And again, this is just your length of stay by month. And you can see those high green bars in the very beginning of this. You can see the 80 to 89. You can see how that was much higher. And you can see if you look at that trend line for each of those, for the most part, is going to be going down. And again, I think just a testament to our medical staff. We have 24/7 critical care intensivists in our ICU that manage these patients. And that is unique for a community hospital such as ours, to have a fellowship-trained critical care ICU doctor that does nothing but focus on our ICU patients. And they've done an amazing job over the last 6 months managing these patients. And the community testing events, last thing on COVID-19, we've done 3 so far. We've got 2 more coming up in September. This is done in coordination with National Guard and DHEC. So we work with them to pick the sites. They bring a lot of resources in the National Guard to help direct traffic. We bring the clinical personnel, and they bring the supplies. And this was one of the events that was not well attended, but still, I think, very useful. We did 218 people in about 3 hours. 7 patients tested positive for a 3.2% positivity rate at our last Ladies Island Middle School event. So with that, I'm going to keep moving, and then I'm sure there'll be questions at the end. But I'm going to go into something that's not COVID-19 focused, and go more into strategic planning, how we grow in our services, how we serve in the community, and really focusing around one of our core values, which is innovation, because we like to think that we're very innovative as a community hospital, and we're really doing things that you wouldn't find many community hospitals doing. One of the things that we're very proud of is how we've improved our oncology services offering. So a couple of years ago, we moved and consolidated all of our oncology services into one building at the Beaufort Medical Plaza. And in doing so, we brought the newest and greatest technology in radiation oncology to Beaufort with the Varian TrueBeam linear accelerator. This helps reduce treatment time. It helps more accurately treat different cancers, saving healthy tissue. You won't find a better linear accelerator anywhere around than the TrueBeam Varian. This is exactly what MUSC uses, and a lot of the other, I would say, academic tertiary care centers use, is the TrueBeam Varian linear accelerator. We've updated our medical oncology and infusion center. We have PET CT services there, state-of-the-art breast health center that has installed a new MRI for breast MRIs, new ultrasounds for breast ultrasounds. Really have come a long ways in technology. And we were opening our second cancer center in November, called the New River Cancer Center, which will be coming to Okatee, which will basically be a mirror image of what we're doing here in Beaufort. So really expanding oncology services across the county, and really focusing on how we provide excellent oncology care to the people we serve. Other things that we're doing is improving access to care through an express care network. So you'll see our express care location at Beaufort, just across the street from the hospital. And then one of our newer locations on One Burnt Church Road in Bluffton. And then we're opening a third express care occupational health urgent care in Okatee. And really what we're doing here is really expanding access to care at a low cost setting. And so if you're trying to decide, where do I need to go for the most appropriate care, we have 4 different opportunities for you. We have primary care, we have telemedicine, we have express care, and we have the ER. And a lot of times what people use the ER for could really be handled at the express care, with urgent care, sometimes ER trained physicians, but just at a lower cost of care, right? And that's what's important to us as we continue to grow our network, is growing it in the right way so we give care at the right time, at the right place, for the right cost. And if we're ever going to lower the cost of healthcare, which, I could talk days about how to, improve healthcare access and the cost of care, you have to start offering lower cost of care with the same sort of access that people are used to with an emergency room. Other opportunities for access to care is our telemedicine network. So this is one of the things where we have really innovated, and you really only see large hospitals and health systems doing this, which is our BMH Care Anywhere app. And so you can access an urgent care app either via your phone, your laptop, a tablet, or a kiosk that you can find in the Publix grocery stores across the county. And we've done about 1,500 visits, especially after the COVID-19 pandemic. We've really seen our BMH Care Anywhere urgent care app explode. We've got well over now 4,000 patients registered, so 4,000 or 5,000 people are now, carrying around a smartphone that has our telemedicine app. And then we also do such things in telemedicine in more rural areas like OB, prenatal care, psychiatry, cardiology, vascular surgery. So not only are we doing telemedicine via app for all your urgent care needs, which are 24/7, and I say all, it's for about 15, 20 very low acuity diagnoses. We're not trying to treat chest pain by any means on a app. What we can do is sinusitis, pink eye is very good at helping with the flu, especially in a time when you may have the flu, but you don't want to go to express care in a COVID-19 world. This is a great opportunity for you to at least get a first opinion versus having to go to a crowded waiting room, to an ER or something else. And, they can work with you to get tested somewhere. We have white glove handoffs on telemedicine. So for example, let's say you have a telemedicine visit. You're not sure if it's flu or possibly COVID-19, because that is going to be a question. Is it the flu or is it COVID-19 come November or December? Instead of then going to an urgent care or to an ER, they can make a referral to one of our urgent cares. We can keep you in your car. We can get you swabbed for both a flu and a COVID-19, and we can get you back to your house until the results come back. That is the opportunity for express care and telemedicine to work together. And that's something that a lot of systems aren't able to do, and we're able to do it. And you see also, if you go to a Publix grocery store, you see that little kiosk there in the left-hand corner. That just has a more meaningful visit. There's otoscopes, there's scales, there's dermatology cameras, there's a stethoscope. There's all sorts of things that you can use with your provider that you can have a very meaningful virtual visit with them. In terms of improving access to care, we've recruited a ton of providers to Beaufort over the last 3 to 4 years. We went back and counted. If you included physicians and nurse practitioners and physician assistants, we've recruited almost 50 plus providers to the marketplace in almost 4 years. You can see some more physicians that are new to the market. Dr. Yvette Pellegrino, not pictured, but you see Dr. Odzar, Dr. Kiesler, Dr. Persani's an OBGYN, several urgent care providers, Dr. Swenson's a GI, gastroenterology physician. And we also have Dr. Ross Watson, who's not pictured, starting at Beaufort Primary Care here at the hospital campus actually next month. September after Labor Day, actually. Dr. Robin Wallace will be at the Okatee building, the brand new Okatee building, in September as well. So we continue to start a lot of new primary care providers, expanding access to care, as there is a massive primary care shortage across the nation, but also in Beaufort County. Speaking of the Okatee Medical Pavilion, this is one of the things that we're very excited about. This is will actually be open November 1st, and you can see pictures of how it's coming along right now. So that is taken as of last week with some drone photos. That's at the corner of 170 and 278, and this is going to be kind of a medical mall where you're going to have all services under one roof, kind of like what we have at the Beaufort Medical Plaza. But you'll have the cancer center, including radiation oncology and medical oncology, a women's imaging center and urgent care, all of our specialties in primary care, as well as MUSC will have a suite here of about 5,000 square feet and rotate a lot of their cancer specialists through that suite. So part of that affiliation is bringing these specialists closer to home, so you don't always have to travel to Charleston for every visit. And that's what's so important about this facility and this affiliation and partnership with MUSC, is working with them to bring the physicians closer to Beaufort, where you can see your physicians in Beaufort, Okeechobee, Bluffton, and not have to go to Charleston every time you need to see one of their specialists. You may still have to have surgery done there, but in terms of having therapy done, whether it's physical therapy, radiation therapy, chemo infusion, seeing them for an office visit, all that can be done close to home. And that's what we're trying to accomplish with the MUSC network. The other big and huge development that we're still working through is South Carolina's first micro hospital. So this is a second hospital. The Beaufort Memorial has the state's approval to build. But if you're anywhere familiar with the certificate of need laws in the state of South Carolina, several hospitals and health systems can oppose the state's decision to allow one facility to build another facility. And so right now we're being opposed in the administrative law courts of South Carolina. But once we get through the process, the administrative law courts, we hope to build a new 20-bed hospital and state-of-the-art ORs in the Bluffton area at Buckwater Place. And so this is, again, just an expansion of the Beaufort Memorial network, of our services, and the really great care that we provide to the county. This is where it's located, again, at Buckwater Place. We bought this land behind Publix in Bluffton about 2 years ago now. And as soon as we get through the process of the administrative law courts, we hope to break ground on our second hospital and just continue to grow our system. Coming back north of the Broad and rounding back to our hip and knee replacement program. So I mentioned earlier that we're an advanced center for hip and knee replacement. Well, most recently on top of that, we've also added robotic knee replacement surgery. We've been doing this now for almost a year. Very excited about the results. Obviously, knee surgeries were a little bit more difficult with the COVID-19 pandemic, as a lot of elective surgeries were postponed. But now that we're kind of come back around to starting elective surgeries again, we've been doing a lot of robotically assisted knees. We've been having a lot of really good outcomes. So many good outcomes, actually, that we're looking at purchasing a second robot for the OR to include a robotic hip replacement program as well. And so our surgeons right now are analyzing that program, looking at the benefits of a assisted hip through robotics. And we think we will actually be moving forward with that in the next couple of months of purchasing a second robot that will help with the hip replacement program. So really just adding on to the already great joint replacement program that we currently have at Beaufort Memorial. And then lastly, renovations come to the future. So we've done a lot in renovations, but one of the ones I wanted to focus on in the coming years is our surgical pavilion renovations, and that's here at Beaufort. And so one of the things that we feel like we have to move forward with in terms of improving the services here at Beaufort Memorial is really just renovating our ORs here and then adding another operating room, because we want to increase some surgical specialties that operate here. Most notably, we want to increase fellowship trained spine surgeons here, as well as grow a plastics program, which will be very complementary to our oncology program that we have here. We have a plan to renovate and add one OR for about $12 million. Our goal is to break ground or to start those renovations where we're starting to knock down walls, et cetera, early to middle of next year. And right now we're raising money through the foundation to pay for what I would say is about 30 to 40% of those renovations, with the hospital coming out of pocket for the other 60 to 65% of those renovations. So very excited about this. If you talk to any of the surgeons, they would tell you specifically, while the rooms are effective and very clean and very sterile, they're very small. And when I just got discussing all the new robotic technology we're bringing to the ORs that weren't there 20, 30 years ago, when those ORs were built, the rooms could be smaller because you didn't have all the trays and the equipment and the robots and different things and these nice big brand new towers with the wide screens that we just recently purchased. Now that all these advancements in technology have come around, those rooms start to get a little bit smaller, and we need to be able to spread out a little bit more so we can continue to advance the technology that we offer to the community. And that's why we're trying to renovate them to grow the size of the rooms, so we continue to bring new technology to our surgeons, new technology to the community, as well as bring more surgeons to the community and grow some of the services that we offer here, specifically around surgical oncology and spine surgery. So with that, hopefully I've done a at least fair job of covering COVID-19, as well as try to mix in a little bit of strategy and growth in there, although it's been hard to focus on strategy and growth in the last 6 months. somehow we found our way and we continue to stay on track. So I will be quiet for a little while and open it up to questions. Ooh, you're on mute.
She's still muted.
You are still muted.
You're still muted.
Okay.
I said, I think you've done an amazing job at covering almost all of our questions, but we do have a few.
Perfect.
So really good news and great information on COVID. I wanted to just get a little clarification around, are y'all doing the rapid test and are you having any trouble with the false positives? Are you working with calculating each person as one person that's come in as COVID? How are those numbers working?
So there are a bunch of rapid tests out there. And so what I would say is we don't have the rapid point of care testing. We didn't really, when we looked and did the research, especially with like the Abbott iLabs and different things of that nature, the sensitivity and specificity wasn't where we wanted it to be. It was well below industry standard. And so we went with what I would say is some other testing that was run on larger analyzers. It's not rapid, but we can turn around anywhere from an hour to, and a lot of it is batched. So if we have a batch ready to go, that analyzer will run all those tests in about an hour, or we can get it within 4 to 6 hours based on the batching. But we have about 3 different ways we run tests right now through 3 different analyzers. And we get this back anywhere between an hour and say 3 hours on average, same day. But what we did is we specifically went with tests that were supported by the benchmarks that we've always used in the lab industry, which is about 97% higher sensitivity and specificity. And so that's why we didn't go with the Abbott lab rapid testing, because we just didn't trust the results. Now, it's not 100%.
No.
So obviously, we've even encountered a few false positives in our testing, but we think we've been able to mitigate and minimize that by really just finding the right test for us and for the population. So we've not been perfect, but I think we've been a lot better than some of the other stories you've seen in the media and the press, around 50 or 60 false positives all in one case. We have not seen that.
Good answer. I like hearing that. So we are having a lot of questions roll in. Please keep your questions coming. I do have a great one that's relevant to COVID. Have any COVID patients had a reoccurrence in your data or your people?
To my knowledge, we've had 2 reoccurrences. I have not seen any more. I remember, and I'm by no means the expert. We have a whole team of physicians and nurses that are dedicated to kind of COVID-19. But over the last month or so, as we've met, and we meet fairly consistently just to stay in lockstep with one another, we've had about 2 reoccurrences where we discharged them, they were negative, and they've come back and tested positive again. So not a high rate as you've seen all the numbers, but we have seen 2 come back and be a reoccurrence.
Great. Go ahead, Patty.
Yeah, thank you, Russell, for your wonderful update. Some of the questions we had have been answered. You've done a great job. I do have one question regarding discharging of patients. When a patient is discharged and they need referrals, do you currently have some kind of setup for a discharge planning service so that somebody can help patients understand how they go about getting the referrals they need? Is something in place at this time?
Yeah, so there's something that's in place, and then there's something that we've just instituted recently. And so for the longest time, we have care managers that are mostly inpatient based, but work with providers and the patients upon discharge to make sure they get a referral to an accepting primary care provider or a specialist as needed. They make that appointment for them, et cetera, and they try and get them there. But to the extent that after they leave the hospital, those case managers are somewhat then out of the next steps of keeping that appointment. So most recently, we have instituted a new outpatient case management department. And so this outpatient case management department will now be the connecting department that these patients will then use post-discharge to make sure they get navigated through the complex system. We've had that as small parts and pieces based on a subset of population. So for example, we had a bridge to home team that was made up of 2 nurses, but they focused on patients that were high risk readmission, mostly COPD patients and congestive heart failure patients. And so we focused on a subset of patients, but now we're growing an outpatient case management department that's going to grow outside of those two subsets of patients and focus on all patients being discharged, making sure that they get back into the primary care provider, or if they don't have a primary care provider, get into a primary care provider, or if they need to make sure that, they came into the hospital with chest pain, they maybe had a procedure done, cardiac catheterization, they need to go follow up with that cardiologist, post-procedure and discharge, that they're following that patient to make sure they keep that visit and make sure that they get in touch and with the cardiologist office. So, we've had a pretty good system, but it was mostly focused on a subset of people. Now we're broadening that system and a new outpatient case management department to almost touch all of our discharge patients.
Okay, thank you.
All right, so let's go into non-threatening conditions. Can you tell us various ways we can get medical care there? Is it the same system, the same 3-tiered tele, emergency care, and then the hospital?
Yes, absolutely. So, and that's kind of going back to the 4 points that we've been trying to create for access to care across the county. So, the first thing that we set out to do 4 years ago, so we have to build our primary care network. There's not enough primary care physicians in the Beaufort County area to serve not only the current population, but a population that's growing anywhere between 4 and 10% based on which zip code you're looking at. And so we've recruited a ton of primary care providers because what we want everyone to be in is somewhat of a patient-centered medical home, right? And that starts with your primary care provider. Outside of that, what we try to do is say your primary care provider isn't always open. They're not open on the weekends, they're not open extended hours all the time. And so how can we provide other points of access outside of just the emergency room? Because that's really the last place you want to be. It's the most expensive form of care that you can possibly access. And you should really only access that in true emergencies. And so that's why we then developed our express care network. That's really the next step above your primary care, but a step below the emergency room. And the good thing about our urgent cares, express cares, is you're going to pay physician office prices for that, right? You won't pay urgent care prices because they're actually licensed as a medical practice, not an urgent care. Yet they do all the services that an urgent care does. As well as you won't pay what you're paying in the ER, but you get the same services, infusions, lacerations, they can do sprains, different things. They can do those at the express care. But the express care doesn't necessarily have to be the only point of access. Telemedicine, like I said, is a great opportunity to access, care at 24/7 for 15 very low acuity diagnoses, right? And that's 24/7, whether it's 2 o'clock in the morning or 1 o'clock in the afternoon on a Sunday. You can access telemedicine, and if your insurance covers it, we bill the insurance. If it doesn't, it's a $59 charge out of pocket, and that's what the telemedicine kind of. That's really dependent on your insurance. COVID-19, Medicare covers everything. Undetermined whether Medicare will continue to cover telemedicine urgent care visits post-pandemic, but right now Medicare is covering telemedicine visits via urgent care. Before they did not. Blue Cross Blue Shield mostly covers it. Medicaid did not before the pandemic. They have been during the pandemic. United Healthcare, hit or miss. Cigna, hit or miss. So it just depends on your plan specifically.
Okay, let me follow up with real quick. I've got some that just came in, and we want to know also about some of the funding ideas. But is it true, or not is it true, but are the primary doctors only, are primary doctors outside of Beaufort Memorial, are they, do they have hospital privileges? And if yes or if no, how do we communicate to them through your network? How does that work? Or do they need to all be within the same circle?
Well, that's complicated.
Good.
So we have many different levels of hospital privileges. And so if you're a primary care provider, you're typically going to be at the community active level, which means you don't come in and really round on your patients. You can come in and kind of do a visit with them just to say, hey, how you doing? How are the hospitalists treating you? Because we have hospitalists that really round on all the inpatients from a primary care perspective, but you'd have community active. And so what I would say is, if you look at everything north of the Broad River, I'm pretty sure all the primary care doctors have community active privileges, which means they're part of our medical staff. They can order testing here. They receive all the results. They work with us on many levels. They don't have admitting privileges, right? Specialists typically have active privileges. That's urologists, orthopedists, ENT, general surgeons, et cetera. And I would tell you that, again, most of the North of the Broad River physicians all have active hospital staff privileges, which means they do surgery here, they can admit here, they take call here for the emergency room. And then you have community active, you have active, and you have a couple other levels of staff privileges that are not used often. So community active and active staff privileges are the two most used. I would say pretty much all of the physicians north of the Broad River follow one of those two categories, and more now south of the Broad River, so Bluffton, Okatee, more of those physicians are either active or community active. Do you have to be on medical staff to refer a patient to BMH? No. You can never be on active medical staff or community active and still refer a patient to a BMH facility, whether it's imaging or a lab or one of our specialists. If you want to refer to, let's say, Dr. Kevin Jones for a joint, you have to be on staff to refer to Dr. Jones and have your knee replaced here. But it is helpful to be on staff because we're able to communicate them with a little bit more ease, because once you come on staff, we give you access to all of our systems.
Got it. So that's something that's pretty important for us to ask if we are looking for a brand new doctor. If you just moved here, something connected might be a good idea. Patty, did you have something?
One, it's a little offline here, but I was wondering, are there any obstacles? I see all this building going on and all these wonderful facilities. Are we having any difficulties in filling positions, or what are the obstacles in hiring doctors and assistants that are needed?
Yeah, that's a really good question. So even before the pandemic, let me back up just a little bit. Healthcare in general is experiencing not only a physician shortage, but a huge nursing shortage. South Carolina as a state, actually, I think we're the 5th worst state in the union for nursing shortage. I think it's predicted that by the year 2025, we may be 5,000 nurses short across the entire state of South Carolina. That's 5,000 open nursing positions predicted in the state of South Carolina. So you can see that puts a big strain on the hospitals and health systems, the nurses, the providers, et cetera. And then post-pandemic, I think what we're seeing now is that we're kind of moving along at a steady state in terms of hiring. But what we're most concerned about right now is that we're seeing a lot of schools saying they're going to forego a certain semester because everyone is so far behind because everything's shut down in the pandemic. And so I think we're going to see not next year, but 2 years from now, when they didn't have a spring class across the nursing schools, the medical assistant schools, the medical technologist schools, the respiratory therapist schools. I think we're going to see a year and a half, 2 years from now, that we're going to have a 6-month time when no one came out of school, no one graduated, because COVID-19 basically threw everything out of whack. And so we've always had a hard time, I think, recruiting to the healthcare sector because there's such a shortage across a lot of the different jobs that we need. But I think COVID-19 is going to magnify that in the next year or two, based on schools just stopping and having to restart.
Wow.
So are we using a lot of the traveling nurses? Are we using physician's assistants? I mean, how are we filling that gap, especially with the new facility being built?
Right.
So the good thing about the Okatee facility that will be done in November is we need less nursing there and more radiation, rad techs, MRI techs, medical assistants, a few nurses, but it's not nurse heavy. Okay. And so the positive thing is that we feel like we're going to get we're going to be able to fill that facility without a lot of issue and concern. The hospital, when we build it in Bluffton, right there at Buckwater Place, especially if that's 2 to 3 years from now, right when maybe the COVID-19 we didn't have a spring class of 2021, right? I think that's going to be very interesting, because currently today in the hospital, what I would tell you is we have probably about 30 travelers in our hospital. That's nurses, that's therapists. We have about 30 people who are not employees of Beaufort Memorial, but are on contract through travel and agencies, which is common. Every hospital in the state of South Carolina is using traveling nurses right now. MUSC, Roper St. Francis, we all are having to leverage traveling nurses because of the nursing shortage. And so we've got about 30 in the hospital right now. 2 years ago, we had none. That ebbs and flows, so to speak. And we, sometimes that depends on how many nurses we're able to recruit from USC Beaufort, as well as TCL. and get them onboarded, et cetera. But right now, today, we have about 30 contract nurses. Our goal is to not have any. But we have them because we want to support the medical staff, we want to support the nursing units, we want to make sure we maintain the appropriate patient ratios, nurse to patient ratios in the hospital. And so we don't want to go short staffed, and so we pay a premium for travel nurses, but it's well worth it to make sure we have the appropriate ratios for our patients. In terms of the doctors, we actually had that building full. So the one good thing about the new medical building in Okatee is we don't have any open positions or PA positions or nurse practitioner positions. We've recruited at a high and successful rate, and we've been able to fill all of our positions. And so now we feel like we're a really good place with our medical staff, and we're going to start focusing on the really hard to get subspecialties, like infectious disease, dermatology, rheumatology, endocrinology. Those are the really hard ones to get. And so now we filled kind of we filled out our network pretty well with surgical specialists, as well as primary care physicians. And so now we're going to focus on how do we fill out some of our subspecialty care. And again, that would include spine, endocrinology, rheumatology, and dermatology as opportunities for us.
Russell, would that include mental health care?
It does. So right now, one of our goals is we have 2 psychiatrists on staff as well as a number of counselors. But as we're expanding our adult mental health unit, we're also looking this year at a partial hospitalization program. That means you're only admitted for a certain part of the day. You go home and you come back for a very intense outpatient type program. But because of that, we're looking at recruiting one more psychiatrist to have 3 psychiatrists on staff here at the hospital to help with the growth of mental health. So we have a lot of big plans around growing our mental health services in the community.
Thank you.
So I have a lot of questions coming in from residents. I think I better start there because we're fast heading towards the hour. So how much of the budget is accounted for by charitable giving, especially for that pavilion, the surgical pavilion project?
Well, I had to go back and look specifically at our numbers. We typically budget, however, anywhere between $50 and $60 million a year in charity care and bad debt. So that remains pretty consistent. And then I would have to take that, depending on how you wanted to look at that, as a percentage of expenses or a percentage of gross revenue, on how you want to look, whether that was 5% or 10%, et cetera. But we do about, like I said, about $50 to $60 million is budgeted every year for free care to the community.
Okay, and during that period, how will the hospital's surgical services be affected?
I don't know that necessarily will be affected. I mean, we see a good bit of that in our ER that moves over into our ORs, and we operate on those people, we admit those people, we discharge those people. So I don't know that looks any different, or the surgical pavilion renovation is affected one way or the other. I think our charitable contributions and giving, our charitable care will remain consistent throughout the course, leading up to, during, and then after the surgical pavilion renovation is done. I think we'll still hover between $50 and $60 million. It could possibly go up. If the Democrats win, I doubt that to be the case. I would only see, things possibly going down. And if South Carolina were to ever expand Medicaid, you see that charitable care go way down, because a number of people who right now don't have insurance would qualify for Medicaid expansion had South Carolina expanded Medicaid. So it just depends on who's in the White House and who sits at the governor's office.
Yes, it does. So I have another one. What is the cost to Beaufort Memorial Hospital as a result of South Carolina not expanding Medicaid to the state?
I haven't done that math specifically, but I would tell you that the states that saw Medicaid expanded, I think they saw their charity care go down by almost a third in those states. If it's 60 million and that trend were to happen here, we go from 60 million in charity care to 40 million or less.
Okay. And then I have another one. I'm trying to go through them because you've answered so many of them really wonderfully. How much of the budget is, we did that one. Let's see. Please expand on network electronic medical records. For example, should my visits to specialists be coordinated and posted to my patient portal? That's a good question.
Well, yes, if you are seeing a Beaufort Memorial employed specialist, things like results, tests, etc., should flow over to your patient portal. If you're seeing a non-employed specialist, but they have active staff privileges here, that would not flow over to your patient portal, if that makes sense. So if you were seeing, I'll use Mark Dean. A lot of people know who Mark Dean is. If you're seeing Mark Dean works at the hospital. He has active medical staff privileges, but he's not employed by Beaufort Memorial. So he is not on our base EMR in terms of his practice. So his information from his EMR would not flow over into our patient portal, a BMH sponsored patient portal. We are working on some opportunities for health information exchanges and coordinating EMRs. We've not been able to really see that project through. But that is the ultimate goal, is to have a better exchange of information across all EMRs, regardless of whether you're employed by BMH or independent, but you work at BMH.
Okay, good information. All right, I think we might be needing to wrap up. We'd like to take some of those questions, Russell, and get them to you. So hopefully you can answer them back. And then when we send this video out, everybody's questions can get addressed. I think I've covered them all, but I'm not going to swear to that. The time started running. So
yeah, I'm happy to answer any other questions via email. Get with Debbie and team, and you can get them to us. We'll try and answer them as best we can.
all right, Becky, you want to?
Yeah, wrap up. Well, Russell, I learned a lot today, and I must say, if any of you watching this are like I am, I'd like to watch this again and to really spend some time with the details. So I would encourage all of you to watch the recorded version when that comes out on the email. But Russell, I have just one final question for you before we wrap up. What can Dataw residents do to if they want to volunteer at the hospital?
Well, right now in the COVID-19 world, we don't have a lot of volunteers coming to the hospital, and that's on purpose. We still want to make sure that we're doing all we can to protect those that we would say are in the most vulnerable population and not be unnecessarily exposed to COVID-19 if possible. But there's always, we have a very robust and very involved volunteer services that is managed by Leslie Suda. We're always looking for more volunteers to help at the hospital in many forms and capacities. And there's also opportunities in the foundation. If you're excited about a particular project and you want to get more involved, there's all sorts of ways to contribute that. It's not always financially, although Debbie would say she would always take a financial contribution. There's committees you can serve on. There's meetings like this you can help organize to generate excitement and buzz about Beaufort Memorial and all the good things we're doing. So there's all sorts of opportunities to get involved with us, either on the foundation side or the volunteer side.
Well, thank you so very much for joining us today. We know you've got a busy day ahead, and I think we all learned a lot, not only about the pandemic, but about the hospital's future plans to make all of our lives better. So for the Dataw residents who are watching, we will have another speakers forum in mid to late October, so stay tuned for more information on that. Until then, have a great September and stay safe and stay healthy.
Thank you, guys.
Thank you, Russell.